The history of surgery. Surgery went through a process, before arriving at the exploits that we see today, those of laparoscopic and robotic surgeries. A perfect knowledge of the anatomy of the human body, its physiology, and its pathologies had to be acquired gradually. This surgery had different moments. The history of surgery contains many important events that we cannot present in full, but we would like to present the most important facts in order to better understand our career as surgeons. Surgery is a set of manual and instrumental operations performed on and in a living body for therapeutic purposes. The prehistoric era. Skeletal pieces, fossils dating from prehistoric times, from the Mesolithic period attest to the practice of surgical procedures such as craniotomies, trepanations, and amputations of limbs. The craniotomies were not fatal because signs of healing were found at the edges of the resections. From the beginning, that is to say from the Neolithic period, our ancestors Homo sapiens must have resorted to an extension of the hand, a tool, or an instrument as simple as a cut flint, to amputate humerus and femur or trep hind skulls. Antiquity. 3 texts from ancient Egypt testify to surgical practices. They were translated from hieroglyphs, respectively by Ebers Griffith, Brush, and Edwin Smith in the 19th century. The first is a treatise on wounds and the third is known as the first treatise on neurosurgery. Although the anatomical knowledge was rudimentary, they already knew how to perform herniorrhaphy, circumcision, and enucleation. A notable element during surgical practices in ancient Egypt was the presence of a man whose sole role was to stop the bleeding. In ancient Greece, at the time of the Trojan War, surgery consisted of simple acts such as debridement of wounds, extraction of arrows, and dressings. Hygiene was essential. Surgery schools did not yet exist and knowledge was passed down from father to son. Anatomical studies could only be done on animals, as Alcmaeon did on goats. We will have to wait until Hippocrates Dacos, 5th and 6th century BC, to have a slight improvement. The Alexandrian school dates back to around 300 BC. It's an anatomical revolution. Herophilus and Heresistratus were very well known during this period. In ancient Rome, part of the surgical knowledge was imported from Greece. Surgery was mainly used for the needs of the army as well as circus games, such as gladiator fights. New techniques were developed, which is how the first caesarean sections were performed in Rome. Galen is one of the key figures in Roman surgery due to his anatomical discoveries and technical innovations. The Galenic era. A dictatorship of 15 centuries, 2nd century to 16th century, Claude Galen was an anatomist, doctor, surgeon, apothecary. He emphasized anatomy. The Middle Age. The most important figure was Abulcasis of Cordoba, 2nd century, author of the Tarsif, a medical encyclopedia written in 30 volumes which was the reference work in European schools for centuries. 200 surgical instruments were presented in this work, most of which were new. Among these instruments were the first instruments intended for gynecological surgery as well as different types of forceps, ligatures, suture needles, scalpels, curettes, retractors, surgical forceps, probes, hooks, speculum, bone saw and casts. He advocated the use of cautery for hemostasis. He was at the origin of the use of ant mandibles to suture skin wounds, replaced today by surgical staples. The influence of the al-Tasrif eventually led to the decline of barber surgeons being replaced instead by physician surgeons in the Islamic world. Ibn al-Nafi devoted a volume of his treatise on medicine to surgery. He describes the 3 stages of a surgical intervention: the preoperative stage, the operation itself and the postoperative period. Avenzoar is considered the father of experimental surgery for having introduced the experimental method in his Al-Tizir. He was the first to use animal experimentation to develop surgical procedures for human patients. He also made the first dissection and the first post-mortem examination, autopsy, on humans. He invented the technique of tracheostomy in the 12th century. The Iraqi surgeon al-Mawzili invented the first hollow needle, and the first injection needle. The Western Middle Ages. The first European surgical school was created in the 9th century. This was followed by the opening of a second surgical school in Bologna in the 12th century. Among the important figures of this school, we find Theodoric, who initiated in Europe the treatment of wounds by dry and no longer by wine, and will replace, for the treatment of wounds, the ointment with the antiseptic. In the 18th century, with more than 10,000 students focusing on medicine and surgery, Bologna was the largest university in Europe. This is also where the first cadaver dissections will take place. In France, the first surgical school was founded in Montpellier in 1220. It was from this university that Guy de Chauliac, author of Great Surgery, Chirurgica Magna, in 1368, the first surgical work in French, came. Some important names from the Galenic period. Mondino de Luzzi circa 1320. Gallian contests. Lanfranc-Salicet, development of surgery in France. Guy de Chauliac and the Great Surgery 14th century. Medieval ideas. Sutures have had a remarkable rise, as has cauterization. The Renaissance. During the Renaissance, printing allowed a better dissemination of surgical and anatomical knowledge developed in the Arab Muslim world. The proliferation of firearms makes amputations more and more necessary. Surgical studies resumed in Italy with Leonardo da Vinci, who performed several cadaver dissections, as did André Vesalius, author of the Fabrica, Fallopi, Verili, and De Carpi. Another notable figure of the Renaissance is Ambroise Paré, who was appointed barber surgeon at the age of 26. He was appointed first surgeon to 4 kings of France, François I, Henry II, Charles IX and Henry III. Among the innovations he brought, we should note the replacement of cauterization by ligation of the vessels. Ambroise Paré is considered the father of modern surgery. The 17th and 18th century. In 1686, the anal fistulectomy successfully performed by surgeon Charles-François Félix for King Louis XIV restored public confidence in surgery. On December 18, 1731, Louis XV inaugurated the Royal Academy of Surgery in Paris. On April 23, 1743, after the publication of the first number of its memoirs and under the leadership of the first surgeon, Germain Pichault de la Martinière, the Academy obtained from the king the definitive separation between surgeons and barbers and the re-establishment of equality hierarchy between doctors and surgeons. The Revolution and the Empire. After the abolition of the Royal Surgical Academy, it was necessary to train new surgeons. 2 health schools are therefore created to train health officers who must quickly become operational. 2 of them particularly marked their era, Pierre-François Percy and Dominique Jean Larrey. During the Battle of Borodino, the latter carried out 200 amputations in 24 hours with a mortality of 3 in 10, relatively low considering the time and the situation. The 19th century. After the fall of the empire, civil surgery progressed again. Guillaume Dupuytren was one of the most notable figures in surgery of this era. Joseph Récamier was the creator of modern gynecology. He performed vaginal hysterectomies for cancer and had developed instrumentation suitable for childbirth. In the second half of the 19th century, hospitals in England recorded fewer deaths than those in France. They were more ventilated, the patients were less crowded, and therefore only 48% died from post-operative infection compared to more than 80% in France. To make the dressings, cold water added with hypochlorite of lime or potassium permanganate were used. Analgesia remained just as basic, with the oral administration of opium, which has a weak analgesic and sedative effect. Despite the absence of antisepsis, surgical techniques developed during the second part of the 19th century. Eugene Coimbra, pioneer of abdominal surgery, went from success to success since 1862 thanks to rigorous asepsis, the practice of hemostasis which he perfected. The Necker Hospital was the first to have a block in 1912. The 20th century. It was before the First World War that major surgical techniques were developed, such as surgery of the wall of the abdomen, the digestive tract, the thorax, and gynecology. The second part of the 20th century saw an explosion of progress and surgical techniques. We then see the development of organ transplants, with the first kidney, bone marrow, and liver transplants in the 1950s, followed by those of the heart, lung, etc. From 1970, we speak of the revolution, because visceral transplants, open heart interventions, minimally invasive surgery could be carried out. The first cardiopulmonary transplant dates from 1982 and was carried out by Christian Cabrol. In Haiti, just before the American occupation of 1915, the country's main hospital was a military hospital. The latter was transformed into a general hospital in 1916. Faced with the need to have specialist doctors, the law of August 14, 1951, then that of October 13, 1952 had established for the benefit of young doctors, the hospital residency system, there allowing them to choose and improve in a specialty of their choice, including general surgery. The Justinian Hospice, the second hospital in Haiti, inaugurated on March 16, 1890, from a private initiative, was transformed into a real hospital in 1920. Between 1920 and 1930, the Justinian Hospital was equipped with a hospital operation. These improvements were made under the administration of Dr. Lanning, 1922 to 1926, an American surgeon. Among the greats of Haitian surgery are, Dr. A. Levesque, Drive S. Bontom, Dr. C. Chevalier, Dr. Boris Chandler. The latter was the head of the surgery department at the State University of Haiti Hospital from 1991 to 1995. Dr. Alex Adam, for his part, was head of the surgery department in 1980. The 21st century. On September 7, 2001, the Lindbergh operation took place, the first telesurgery operation completely carried out successfully by a surgical team located in New York on a patient located in Strasbourg. On August 1, 2008, the first transplant of 2 entire arms was carried out in Germany at the Munich University Clinic, by a team of 40 people under the direction of Professors Christoph Jahnke and Edgar Beamer. In neurosurgery, progress is also considerable. Patients operated on while awake make it possible to refine the intervention and now have a good chance of surviving without after effects. It is the emergence of awake surgery. Conclusion. Man, in order to treat different surgical pathologies, has organized himself in a very surprising way. Indeed, from the Mesolithic period, between 10,000 and 5,000 years before Jesus Christ, he already knew how to carry out very difficult surgical interventions such as craniotomies. In ancient times, 3,500 years before Jesus Christ, 600 years, in Egypt, surgeons already knew how to perform herniorrhaphy, circumcision, and enucleation. In the Middle Ages, already 200 surgical instruments were counted by Abul Qasis of Córdoba. The first European surgical school was created in the 9th century. With Ambroise Paré and André Vassaille, the human body is finally known in its entirety during the Renaissance. On December 18, 1731, Louis XV inaugurated the Royal Academy of Surgery in Paris. As for the 19th century, Guillaume Dupuytren was one of the most notable figures in surgery of that era. From 1970, we speak of the revolution, because visceral transplants, open heart interventions, minimally invasive surgery were mastered. On August 1, 2008, the first transplant of 2 entire arms was performed in Germany. This story is fascinating. We must maintain it and make our